Good afternoon, everyone. We're here to provide an important update on the latest local news regarding coronavirus and the disease it causes, COVID-19. And I want to thank Sharon for being here once again to provide interpretation for this conference. I also want to thank several special guests who are here today. We have Interim Health Director Pat Lopez, Derek Vance, the President of CHI Health St. Elizabeth and CHI Health Heart, Nebraska Heart, Russ Gronwald, President and CEO of Bryan Health. So thank you, gentlemen, for being here. We are likely to be doing these updates more often moving forward. Because of that increased frequency, sometimes I will lead them, sometimes my colleagues might. But we will provide you with the most timely, accurate, and complete information that we have available. This is a public health emergency that will be with us for months, and we will be here to inform you every step of the way. The health and safety of our employees, residents, businesses, and visitors remains the highest priority for the City of Lincoln and Lancaster County. I want to establish up front a few rules of the road for these briefings and those that follow. First, what we can tell you, we will tell you. There are some details today which we will not release until we have been able to notify individuals and family members. This is due to medical privacy laws that we must honor. We will balance those medical privacy requirements with the need to give you timely and accurate information. So again, when we can give you something very specific, we will. If we are not yet able to do that, we will come back as quickly as we can to provide you with answers to your questions. Finally, we will call briefings whenever necessary to ensure that you have the most timely, accurate information to help protect the health and safety of our residents. Moving on, we're going to talk about what we know. We are here to announce that local health officials are reporting the first lab-confirmed positive case of COVID-19, the disease caused by the novel coronavirus, and that's here in Lincoln. It was a travel-related case, not a case of community transmission, and that's an important distinction that we want to be clear about. This is a travel-related case. As of 2:30 p.m. this afternoon, that brings us to a total of 37 confirmed cases of COVID-19 in Nebraska. The Lincoln-Lancaster County Health Department confirmed the case this afternoon, and at this time I would like to ask that our Interim Health Director, Pat Lopez, please come forward and tell us more about what she knows related to this case.
This first lab-confirmed positive case of COVID-19 is a travel-related case, as the mayor said. The individual is a 48-year-old male who was in Colorado March 8th and 9th, before becoming symptomatic on March 15th. The individual visited his healthcare provider on March 16th. The provider tested for COVID-19 and advised him to self-isolate at home until the test results were received. The provider followed protocol and immediately contacted the health department when the test came back positive today. The individual continues to self-isolate at home. It is early in the investigation at this point, but we are working quickly to identify close contacts. The contacts are self-quarantining, and they will be contacted daily by the health department nursing staff. Testing will be conducted if they develop symptoms.
From the beginning, our public health officials have said that it's not a question of if, but when our community would see a case. Lincoln and Lancaster County residents can be assured that our local public health officials have been, along with our community partners, preparing for weeks for this moment. We are taking this change in our community's status very seriously because we know that for those who are considered at high risk, older adults and those with underlying medical conditions, the virus poses a very serious threat. Every decision we make will continue to be based on how we can best protect our healthcare workers, those at-risk individuals, and all of our residents with every available resource. While this latest development is cause for significant concern, it is important that we all remember that for the vast majority of people who end up contracting coronavirus, the impact to their health will be minimal. At this point, I would like to introduce the folks from Bryan and St. Elizabeth who are here today. If Russ Gronwald could please come forward along with Derek Vance. Thank you.
Thank you, Mayor. Just a reassurance, as we've said for many weeks now, that we as a health system are prepared for these kind of situations. It takes a lot of time and planning, and we're ready for that. We have been behaving for the last couple of weeks, last 2 weeks, as though this is already in our community, acting as though it were. And so important to know that we're ready for that. Would just remind people, as the mayor said, the vast majority of people that contract the virus will be minor. The symptoms will be minor. But that said, we want to maintain the spread as slowly as possible. So our ERs are here and ready, but not everybody needs the ER. So what I would encourage, if there are fears or concerns, one avenue, one resource that we have put out is chihealth.stelizabeth.com or nebraskaheart.com. You can go on, take a quick survey, and answer a few questions, and we'll be able to determine your level of risk for COVID-19 so that we can get you pointed to the right direction. That might be the emergency room, that might be your primary care provider, but that resource is there and available 24/7. So, thank you.
Yes, same message from Bryan Health. What we would want to encourage you to do is to get onto our website, check out possibly our nurse hotline if you're concerned or confused about what your next steps are, and they can point you in the right direction. Our Easy Visit online has a respiratory screening, and we have the walk-up clinic out at our LifePoint location for respiratory symptoms in particular, as well as the normal urgent care. So that's the best way to go. There's no sense in doing anything than what we've been encouraging you before. We think calmness prevails. It's the most important thing that we can have right now is just calmness over this matter.
Thank you, Derek and Russ. As you can see, we've been working very closely in our community with our partners. We will continue monitoring the community and continue investigation at this time. We are daily monitoring, as we have spoken of before, and seeing what's going on in the community. And the health department knows if we're having an increase in respiratory illnesses or other types of illness in the community, and we are alert to that and reach out to our providers. We've been using the incident command structure for several weeks now, and many people from city departments and the healthcare community are working to coordinate our response. And I would encourage the same response. Remember what we have available and refer to those for those that need it.
The arrival of the first confirmed case of COVID-19 in our community brings increased urgency to the need for all of us to comply with the guidelines that have been issued by the state and the Centers for Disease Control. And those have to do, first of all, with monitoring for symptoms. We can all self-monitor. Symptoms of COVID-19 include fever, cough, sore throat, and shortness of breath or difficulty breathing. Those who experience these symptoms should self-quarantine and first call their medical care provider for a recommended follow-up before going to their offices. Please do not go to the emergency room unless it is essential. And while officials are working to increase the number of tests available in Lincoln, testing does continue to be limited and is prioritized for those who are most vulnerable or in those high-risk populations. According to the state guidelines for COVID-19 testing, patients who have symptoms and who have been diagnosed as not having flu or other respiratory illnesses will now be considered presumptively positive and will be considered for testing. Patients who are considered presumptively positive should self-quarantine for 14 days as they wait for resolution of their symptoms or further direction from their medical care provider. Those who are prioritized for testing remain these groups: healthcare workers, public safety personnel, residents and employees of nursing homes and group homes, those attending or working at daycares, and people over 60 or those with underlying health conditions. Those who have no symptoms do not need to contact their health provider about getting tested. Please do not go to the urgent care, the emergency department, or a doctor's office to get a COVID-19 test. Those test kits and medical personnel must be reserved. These precious resources must be reserved for individuals in the prioritized categories at this time. Again, we are working to build capacity for testing, but we are where we are at this time. Everyone can do something, though. Everyone needs to be following the common sense hygiene procedures to prevent the spread of the virus. Wash your hands often with soap and water for at least 20 seconds. If soap and water are not available, consider using a hand sanitizer with at least 60% alcohol content. Please cover your nose when you cough or sneeze, preferably with a tissue that you then discard into the wastebasket. Please avoid touching your eyes, nose, or mouth, and greet others with a smile instead of a hug or a handshake. We will continue to update you and to post the latest information on our coronavirus response at covid19.lincoln.ne.gov. You can go to the main city webpage. There's a banner that says COVID-19. If you click it, it will take it to the latest information, along with links to our health department site at health.lincoln.ne.gov. And lastly, we have a hotline at the health department for those needing to get medical information about coronavirus. That hotline number again is 402-441-8006. At this time, we know that a lot of people are going to have questions and concerns, and we're here to respond. If we could open it up for those questions, there are a number of us here ready to take them. Any questions from the media?
Chris Dunker from the Journal-Star.
Yes, Chris.
Do we know where in Colorado this man traveled to?
I'll ask Director Lopez to field that question.
As far as we know right now, Chris, it was around the Denver area, but we are still in the early stages of the investigation for that piece of information.
We have a question from Bailey, 1011 News. We've heard comments from viewers and doctors that it seems that Omaha is getting more access to tests than Lincoln. Is this true?
I was on a phone call with the governor and members of the UNMC medical team, along with Mayor Stothert today, and Pat Lopez and the state's medical director, Dr. Gary Antone. And what was affirmed in that conversation was that the same criteria are being applied to everyone who requests information for testing. The same criteria applies statewide. There's no preferential treatment being given depending on where you live.
We have a question from Paul Hamill. Will new restrictions be ordered on gatherings and businesses as have been ordered in the Omaha area?
We already have asked our community to voluntarily use social distancing to not attend mass gatherings. All of those events have been canceled that I'm aware of. And we're also asking that people not be in areas larger than 10 people present. And so far that seems to be working in our community. And we have to remember that in Omaha, they have had 2 cases of community-acquired positive COVID-19. That is not the situation right at this point in Lincoln.
And so to be, can I just, to clarify, I'm sorry, Chris, I just want to follow up on Pat's comment and then we'll go to you. To be clear, at this time, we are not issuing any different guidance for the business community because the trigger for future guidance or more strict measures will be when we have a community spread case. That is not the case today. So the guidance in place today in Lincoln remains the guidance in place. Sorry, Chris, go ahead.
Yeah, so about a week went by between this guy returning to Lincoln and him going to the doctor. Do we know anything about where he might have visited in the community during that time that we can share?
Chris, I think, as I said, he became symptomatic on March 15th and he saw the doctor on the 16th. He was already self-isolating at home before he went to the physician. He was not symptomatic before that time.
So can you not spread the virus if you're not symptomatic? I mean, could just being in close contact with people, could he have spread it? in that time period?
I think if I understand your question, Chris, you're recognizing that he was in Colorado on the 8th and the 9th, but only became symptomatic on the 15th. So there's about a week there where he was not symptomatic. What the job of the health department is to, I mean, this is an early stage investigation, but they will need to investigate where that individual was, and they're doing that actively as of this afternoon to try to make sure that we can identify anyone who may have potentially been exposed. Do you have anything to add to that?
No, that's actually, and I'm sorry, Chris, I didn't understand what you were asking. But yes, that's the case right now, so I really can't go further than that at this point.
Do we know how soon possible exposure, locations of possible exposure to COVID-19 in Lincoln will be known?
We will continuously update and have more information. We expect to have more information by tomorrow, but we have to also be able to contact those individuals and follow up, and that's what takes some time in this situation. But we have a team of over 15 staff nurses working on this case and following up.
We have a question from KZUM about global mapping applications. And with the health department will deploy similar web app to detail where negative test, active case, and monitored cases are to further inform the community.
We are working on an application right now, and that's all I can say at this point, but we certainly will get more information out, and we'll provide that to Diane.
Is there a backlog of tests out there right now, or have all of the tests that have been done come back with results?
We have 2 pending tests waiting right now for results in our community. But I need to tell you, those are the tests that are at the public health lab. We don't have the specific knowledge of what's being done in the private labs, and those take a little bit longer to get, but they are all reported to us.
We have another question from Bailey. How do you know whether or not there's community spread without more widespread testing?
We can't really talk about community spread unless we have a case that's positive in the community that's not linked to another case that's been positive or to travel as identified in the guidelines.
You know, these questions keep coming up about this, and I want to try to reassure you that we are aware that there are not enough tests for every individual who would like one. There are not enough tests for every medical care provider that would like to be able to use them. And in some cases we have tests, but there are related pieces of the testing kit, like a reagent or a swab that are running low on production. You know, this is a public health emergency, and folks are trying to ramp up the supply of needed testing materials as quickly as possible. There are many orders that are being placed, and we're waiting to hear back on whether or not those will be fulfilled. And we continue to work with our state and federal partners to try to ramp up the capacity to test. So I know that's not the answer that everyone's looking for. We don't have universal tests. The more testing that we do will give us better data, and we will continue to provide all of the accurate data we have so that people can make informed decisions. But this is where we are right now. Right, if there are any other questions? If not, thank you for joining us. We'll come back with more when we have it.